Kate and Prince William became the first members of the royal family to visit workers on the front line battling the deadly disease when they popped into a 111 call centre in South London. Prince William praised the health service as representing the very best of our country and society as he thanked staff on behalf of the royal family. And he urged the public to play their part to protect the most vulnerable by staying at home if a family member has symptoms and avoiding non-essential contact to prevent spreading the virus. Speaking after he and Kate visited the centre in Croydon, South London, the Duke said, "The last few weeks and more recent days have been understandably concerning with the continuing spread of coronavirus. But it's at times like this when we realize just how much the NHS represents the very best of our country and society, people from all backgrounds and walks of life with different experiences and skills, pulling together for the common good. Not only are NHS staff and emergency workers responding to the needs of the public, they, like the rest of us, are concerned about their families, friends and loved ones. They need our support as much as we need theirs. That is why Catherine and I were proud to visit staff working at NHS 111, to pass on our personal thanks, along with those of my grandmother and father, to staff working around the clock to provide care and advice to those that need it most. It was also brilliant to see the great online tools for those with mild symptoms or worries. All of us have a part to play if we are going to protect the most vulnerable. That means acting on the latest expert advice, staying home if we or those we live with have symptoms, and avoiding non-essential contact to help reduce the spread of the virus." William and Kate followed health guidelines throughout their visit on Thursday, making a conscious effort to distance themselves from people they met, avoiding handshakes and twice stopping to use hand sanitizer. When Supervisor Courtney Campbell, 32, briefly forgot the rules and instinctively reached out to shake their hands, William laughed. "Don't shake hands." But he added, as they posed for a picture, "We can do a photograph if we are not within a meter of each other." As they chatted to call handlers, Kate, who wore a pink trouser suit from Marks & Spencer for the outing, told them, "It's amazing. You're doing such a great job bringing everyone together and providing the support system for the whole public." William, himself a former air ambulance pilot, added, "There's a lot of people out there who want to help. A lot of work is closing down elsewhere, so people are going to want to come and volunteer. People want to help, people want to be there to support you guys, and everyone knows what a fantastic job you guys are doing." Tracy Pigeon, 54, a manager currently helping with calls, said the Duke seemed nostalgic for his old job as a pilot for East Anglian Air Ambulance. He misses the helicopter, being on the front line. He just said he misses it, she said. Asked whether the Duke might be a useful recruit, London Ambulance Service Chief Executive Garrett Emerson replied with a smile, "As he knows well, we have an air ambulance service here in London. I know that he would be welcome there any time." At the moment the 111 service, which in London is run by the ambulance service, is dealing with about 25,000 calls a day across the capital. Normally that figure would be about 7,000. More than 95% of calls are normally answered within 60 seconds, but the unprecedented pressure on the service means most people are holding on for more than an hour. Dr. Agatha Nortley-Mesh, a GP and the Assistant Medical Director of the London Ambulance Service, told the couple the call centre had a multidisciplinary team with GPs, pharmacists, nurses and paramedics who are working extremely hard. She added, "Within the massive volume of calls, there are a lot of people asking for advice and reassurance. But there are also some really sick people in there. It's about making sure we get people to the right place, we get people the advice they need, we get people the care they need." Trying to soften the mood, William thanked the staff before leaving, adding, "I think we are all going to have a lot of TV to watch in the next few weeks."